Carlin Nichols received her Bachelor's of Arts in Psychology at the University of Michigan in 1990. She has since received her Master's of Social Work with a focus on children, family, and youth in 1994. Since graduation from University of Michigan, Carlin has spent her career working with children, youth, and families with complex needs and involved in juvenile justice, child welfare, and public mental health. As the Director of Children's Initiatives for Detroit-Wayne County Community Mental Health Agency, her focus has been on developing a comprehensive system of care for children and youth who are served by multiple systems. In her current role, she is responsible for program development, utilization management, contact management, and workforce development. Please welcome her.
Thank you, and thank you for coming. We're going to spend a little bit of time helping you understand how the public mental health system works. The objectives we have for today are to understand who's actually eligible for services in Detroit-Wayne County Community Mental Health Agency, to understand how to access services through the agency, and to understand the difference between the developmental disability, serious emotional disturbance services that are available to these clients, and to know the services that are available to children, youth, and families. So what is public mental health? Public mental health, the Michigan Department of Community Health actually manages the public mental health system here in the state of Michigan. And Michigan Department of Community Health actually seeks to ensure that those who are eligible for mental health services, substance abuse services, as well as developmental disability services have access to services in those particular communities. This is administered through the mental health code. And because a number of the services are Medicaid services, they're also administered through Medicaid waivers. So Michigan Community Mental Health, the services are delivered by two particular types of organizations. One is what we call CMHSPs, Community Mental Health Service Programs, and there are 46 around the state of Michigan. And these are the specialty programs. And we also have what are called prepaid inpatient health plans, which are the Medicaid provider agencies, and there are 18 of those across the state of Michigan. So the state of Michigan has what's called a 1915B and a 1915C waiver, the Habilitation Supports waiver, and these are waivers that provide for the direction needed to provide community mental health services in a community-based setting. The focus of the services that are provided in public mental health are really community-based. Many of you probably remember years ago when a lot of the psych hospitals were closed, this time of deinstitutionalization. And so that's when we began to focus far more on community mental health services, community-based services. So what we have are a number of services and specialty programs in the community. So through the PIHPs and the CMHSPs, Community Mental Health Service Programs, what you have is a whole range of services, very specialized services that are provided to those who have severe mental illness in their communities, all for the purpose of ensuring they can remain in the community and not be placed in hospitals, which we don't have very many of. So, community mental health service programs, most of the money that we get to serve this population is actually Medicaid. So those are folks who are Medicaid eligible actually have access to these services. And we'll talk a little bit more about who this population is, because there's a lot of confusion about how the services are actually organized. CMHSPs and PIHPs, now that I've educated you on those two acronyms, you can add those to your list. They actually serve the most severe of those who have mental illness in our community. So I'm just wanting to lay the groundwork of the actual funding and how it's organized for you. And then I'm going to show you a welcoming video. Now, this is the video that we use at Detroit Wayne County Community Mental Health Agency in order to, it's really geared towards consumers. However, I think it's a great way for you to get the big picture of Detroit Wayne County Community Mental Health Agency. And as you look at it, I want you to consider how Wayne County is the largest county in the state. We serve the most Medicaid eligible folks in the state of Michigan. We serve about approximately 68,000 people a year. So our system is a little different than what you see across the state. However, when we talk about the PIHPs and the PIHPs and the CMHSPs, the reality is that the mandates are the same. So I hope that once you leave here, you have a clear understanding of how services to those who are the most severe in our community are organized, and particularly how to access services here in Wayne County. So we're going to show the video.